Welcome back to the Doctor is In television program. I am Dr. David Morwood. I am a board-certified plastic surgeon here in beautiful Monterey, California. Thank you very much for being with us today. I'm delighted to be able to talk during this first segment about an introduction to facial rejuvenation. This can be very confusing to people. There's Botox, there's fillers, there's fat grafting, there's facelifts, there's mini peels, there's surgical peels and medical peels, there's laser. And where does a person start who wants to look their best? Allow me to say that it's normal, natural, and healthy part of human DNA to want to look your best. It's part of our DNA, it's within our chromosomes. And for thousands of years, our species has been modifying our appearance from scarification or stretching out our earlobes or stretching out our neck or binding our feet or making tattoos or piercing parts of our bodies. This has been going on for thousands of years. It's part of our DNA to want to be attractive and look our best. So how does one go about making the decision whether or not to go to the med spa, to see a nurse injector, to see a plastic surgeon, dermatologist? How does one go about this? Well, I'd like to once again return to our concept of the triangle of beauty. What happens with aging and what is it that we can affect to help a person look their best? With the triangle of beauty, there are three parts, of course, three parts to the triangle, three corners to the triangle. There's the skin. And essentially what we're talking about is the texture of the skin, the surface of the skin. Things like fine lines, wrinkles, liver spots, age spots, sunspots, that sort of texture of the skin, dyspigmentation. Sometimes people lose the sheen of their skin. They lose that glow with time after sun exposure or with age. So we're talking about treating the surface of the skin. That's the first part of the triangle. The second part of the triangle is volume. You've heard me say this before. As we mature, we tend to lose fat in our face and in our hands, and we gain that fat, we gain that weight in our trunk. It's kind of an unhappy, practical joke, but that's what happens because of time and hormonal changes and changes in exercise and perhaps the way we eat. We tend to lose fat in our hands and in our face, and we gain the weight in the trunk. So what's the effect of that? Well, as we lose fat in the face and we lose that volume, that allows gravity to take over and pull downward on soft tissues. So people can get a more sallow appearance. It can, with time, the mid-face, for example, the cheeks tend to tug on the lower eyelids, tugs on the eyebrows, tugs on the jowls, etc. And hence, it can often make the neck look a lot heavier than it is. There is some evidence that the neck itself may increase the amount of fat that collects there with time. But certainly the face and then the hands lose fat with time. We lose volume and we gain that fat in the trunk. So the third component of the triangle is the soft tissue position and amount. Now, the way we address the soft tissue position and amount is primarily with surgery. Most people, when they think of plastic surgery, they think of eyelid tucks, blepharoplasty. They might think of a neck lift or facelift or short scar mini lift, etc. Those are surgical procedures, probably the most powerful tool that we have. But of course, there's some downside. It's the most invasive. So once again, the triangle of beauty. We need to look at the texture of the skin. We need to look at the volume changes. How much fat has a person lost in their face and where has it gone? Has it shifted downward? And we need to look at the soft tissue position and amount. And you've heard me talk about this triangle of beauty before. And of course, like every other building, the triangle has a foundation. So it sits upon what we call the foundation of the face. That's the craniofacial skeleton, the size and position of the chin, the cheekbones themselves, the corners of the jaw. We call those the mandibular angles. The size and shape of the nose, the ears, the forehead. It's important to note that with time, the craniofacial skeleton, in other words, the bones themselves, can shift somewhat and actually lose volume. The maxilla, which is the midface, can actually tilt a little bit. The dentition can change. Of course, the jaw can change. And so oftentimes we will go one step deeper from the triangle of beauty and look at the actual foundation of the craniofacial skeleton to see if we are interested in changing anything, to see if the patient wants something changed, etc. So, once again, the triangle of beauty sits upon the foundation, and we have lots of tools in our armamentarium. People can go to the med spa, they can see a nurse injector, they can see a dermatologist, they can see the plastic surgeon. What I want to do is offer you a framework so you can help design a program for yourself. If you're interested in improving your appearance or looking your best, perhaps looking more youthful, looking more arrested, looking more awake, looking more lively and vibrant. How do you go about doing that? Well, I think a good place to start is either at the med spa, supervised by the plastic surgeon, or see a plastic surgeon himself. So within that consultation, when you see an experienced med spa nurse or nurse injector, or even an esthetician, facialist, or plastic surgeon, perhaps a dermatologist, I think it's really important that we sit. For example, in my office, we sit during the consultation. We reviewed your photographs. We're very fortunate to have the Vectra. That's a 6-camera computer analyzer. It's 6 cameras attached to a computer. You can have your image taken. It's just like having a photograph taken. Those 6 images are fed into the computer, and you can see your image in 3 dimensions on the computer and rotate it, and we can do some conservative surgical sculpting, etc. But the first step with an experienced plastic surgeon is to sit in consultation and discuss what it is that you want, what it is that you see. Do you want to change the texture of your skin? Are you bothered by fine lines and wrinkles? Are you bothered by pigment changes? Have you noticed that you've lost volume in your face? I've had people come in, especially women, say that they feel like they used to be a plum and now they've become a prune, or they feel that they used to be a succulent grape and now that they've become a raisin. They have an intuition that there's been a volume change, and with that volume change, it's very similar to what happens to the grape becoming a raisin and what happens to the plum becoming a prune. Perhaps the old style or perhaps more traditional way of treating someone like that with a facelift is to make an incision and pull that skin tight enough to stretch out the wrinkles, and then remove the extra skin and sew up quickly. That's perhaps the older and more traditional way to treat aging. That tends to give people sometimes a stretched look, more of a flattened look, especially of the mid-face. And what we want is a face that projects. We like a face with volume. We like a face with definition. You all have probably heard the expression high cheekbones or a well-defined chin and jaw. That comes from having a full face, a volumized face, a solid, well-defined, chiseled craniofacial foundation, if you will. If you think about a baby with those fat, rosy cheeks full of fat, as compared to someone 70 years older than that baby, you're going to be able to, with intuition, just by observing, notice that there's a change in the amount of fat and a change in the volume. So, in my office, the first thing we need to do, of course, after reviewing your medical history, reviewing what treatments you've had in the past, discussing how much sun you get, what it is that you want to change, is we can look at you and help you custom design an approach. This is not the type of thing, certainly not in my office, where everyone gets the same cookie cutter approach. We don't do the same thing for everybody. We don't offer laser to everybody. We don't offer some magic, this type of lift and that type of lift. Custom designed approach. So, what is it about the skin? Number one, skin texture. I'm lucky that during the next segment, we have a wonderful esthetician, Alura Cortez, who will be speaking with us and teaching me and hopefully teaching you about proper skin care and what we can do to help rejuvenate the skin. I see there are 6 basic steps to helping your skin rejuvenation. Number one is avoiding the sun. We all love the sun, but the UV rays are damaging to the collagen, damaging to the elastin, etc. Number two, second only to minimizing your sun exposure, is to avoid smoking. Smoking a cigarette has thousands, millions of oxidants, and you've all heard of antioxidants like pomegranate juice or treatments like that, or foods like that, to counteract oxidants. A puff of cigarette smoke has thousands of oxidants. It's almost like rusting the skin. Following that, a person needs to learn how to properly cleanse the skin, moisturize the skin, and help to exfoliate. That very thin, very top layer of the skin is not living. It's like hair and nails. And we'll get more into this in depth during our next segment. But we need to learn how to encourage the skin to exfoliate. If that top layer, the keratin layer, gets too thick, then a person can lose the sheen, lose the glow of the skin. And then there's the regeneration. We want to encourage the baby cells, the little factory, the germinal matrix that makes new cells, to really turn on and churn and get to the top. And we're going to talk about in our next segment that it takes at least 30 days for a new baby cell to get from the germinal matrix to the top where you can see it. So you've got to hang in there and let your skin program, let your esthetician, dermatologist, or plastic surgeon help you with your skin for long term. It's like taking care of your teeth. We can also, in the office, talk about things like laser, or what I like are TCA peels. That's a way where we can rapidly exfoliate the top layer of the skin, the keratin layer, and some of the epidermis, and encourage new growth from underneath, resulting in finer, smoother skin. And we can talk about the pros and cons of laser and TCA peels, but I think they can be very valuable. But to emphasize this concept, the first part of the triangle is the skin, and what we want is to have your skin be as pretty and as attractive as possible. Number two, the all-important concept of volume restoration. You heard me in the prior, actually you heard me prior in this segment talk about the more sort of older traditional style facial rejuvenation where we'd stretch the skin until the wrinkles come out and then we cut off the extra skin and sew up. What we like to do more often now is a volumetric restoration. If we think of that grape and raisin, or if we look at that prune and plum, instead of stretching the extra skin, why don't we revolumize and rehydrate, because we want supple, soft, beautiful skin instead of stretched or a pulled look. Here in Carmel, Monterey, Pebble Beach, we mostly are in favor of a natural look. This is not like other parts of California, perhaps, or other parts of the world. We like a well-defined, natural-looking, beautiful appearance, youthful or more vibrant, instead of a pulled, overly tight. So there are two broad ways that we can do volumetric restoration, or I should say three. The first is by repositioning some of the fatty compartments that have descended. That's number one. That's a surgical procedure. Number two is with fat grafting. Fat grafting is when we do a little conservative liposuction. Instead of discarding the fat, we can graft it to the face. It's like planting apple seeds, like Johnny Appleseed, walking around with a big sack of apple seeds and spreading them around, and some of them can take root. In general, about 67% of the volume persists. We transpose those fat cells from the tummy or the hips or the love handles to the face to give a more volumetric restoration. We overcorrect because about 67% of those fat grafts, the fat graft volume would take. The other category is the use of fillers. Fillers, many of you are familiar with collagen, or you've heard of collagen. We have Juvederm, we have Restylane, we have Belotero, we now have Voluma. There's a calcium based filler called Radiesse. In general, the fillers that I use are hyaluronic acids based. It's a natural substance found in the skin. It helps us to hold on to water. So by injecting on top of the cheekbones, we can augment them. We can do a conservative chin advancement. We can emphasize the angles of the jaw, the corners of the jaw. And sometimes we can help to fill in fine lines. Sometimes we can help to fill in deeper lines, like etchings and wrinkles. We can help with fillers. You need to have a realistic expectation of what fillers can do, but in a certain, I should say, in a specific circumstance for the right patient, fillers can be very valuable. Now, before I go on, I want to distinguish between fillers and Botox. A lot of people get confused between fillers and Botox. A filler is a volumizer. It's a substance that we inject that can last anywhere from 3 months to 6 months, 6 months to a year or more, perhaps 2 years or longer, depending upon the filler and the G value and where we're injecting it and if there's motion there and how deep it goes, etc. So a filler like Juvederm, Restylane, Belotero, that's a volumizer. Botox, on the other hand, is a muscle relaxant. We can do conservative facial shaping by affecting the muscles. We can treat the deep furrows in between the eyebrows. We can conservatively, subtly shape the eyebrows. And we can minimize fine lines and wrinkles in certain areas. Now, for example, the glabella is this area in between the eyebrows at the root of the nose, at the top of the nose, near the forehead. Oftentimes I'll see people come in and they say their colleagues or their clients tell them or ask them if they slept poorly or are they in a bad mood or they're concentrating or worried about something. That's just the muscles contracting. So the effect of Botox, think of an accordion. An accordion, like a wonderful friend of mine here in Monterey, the honorary king of Monterey, think of the accordion going back and forth. That's similar to the muscles underneath the skin in between the eyebrows. At a certain point, after going back and forth hundreds of thousands of times, like an accordion, or folding a paper back and forth 100,000 times, eventually, even when you're not folding, there'll be a crease. That leads us to the principle of how Botox works. If we let the muscles relax, then the overlying skin is not folding, and so a line or wrinkle will either disappear or soften. That's Botox. It's a muscle relaxant, a muscle relaxer. It has many medical uses as well. Migraine headaches, muscle spasms in different parts of the body, forearm spasms, etc. So we can use that muscle relaxant to our advantage. And there are certain depressors of the brow, for example, the corrugators and the procerus and the orbicularis. There's a big elevator of the brow, the frontalis, so we can selectively get the depressors to relax and let the elevators take over with Botox and thereby do a subtle reshaping of the brow. Now, the third component in the triangle of beauty, perhaps the most powerful component, is to affect the position of the soft tissue and how much of soft tissue is there. Most people, when they think of plastic surgery, cosmetic surgery, aesthetic surgery of the face, they think of eyelid tucks, blepharoplasty, lateral brow lifts, mid-face elevations, or facelifts, or neck lifts. I do lots of that work. It can be very powerful because we can dramatically affect the soft tissue position and amount. We can shift it into different places. We can put it back where it's supposed to be. We can mold and shape and tailor. We can put, for example, the cords of the neck or the lax tissues of the neck into a much more pleasing, crisper, firmer place or appearance. So a surgical procedure can be very effective. It's probably the most powerful tool we have in the triangle of beauty. But of course there's a downside because it's more invasive and it's a surgical procedure. Keep in mind, as I said, that triangle of beauty is on top of the foundation. Sometimes we will offer someone to advance their chin or put in a chin implant. Sometimes we will want to augment someone's cheekbones or emphasize the angle of the jaw, etc. Change the ears, change the nose. Those are foundational affecting procedures. So once again, in summary, the triangle of beauty, we have the texture of the skin, and we're going to talk to our wonderful esthetician in our next segment. We can affect the volume with fat grafts and fillers, and by fat compartment repositioning. Then we have the surgical soft tissue repositioning and to affect the amount. So that's soft tissue position and amount with surgery on top of the foundation. If you'd like any more information about this concept of modern volumetric facial rejuvenation, I hope you'll go to my website, drmorwood.com. That's www.drmorwood.com, or call me in Monterey, California, 831-646-8661. This is the Doctor is in television program. We're going to take a very brief pause for a very good cause. Thank you for being here.
It's scary making the decision to have reconstructive surgery, but it's so worth what you get out of it.
I'm stress-free. I know I'm not going to get breast cancer.
Everything is back to normal, and it really did not take long to bounce back.
I have a sense of hope for other women that this surgery can help them to live normal lives.
This year, more than 200,000 women in this country will be diagnosed with breast cancer. For many of them, a mastectomy or removal of the affected breast will be recommended as part of the cancer treatment.
The idea of losing a breast for some women can be almost as difficult as being diagnosed with breast cancer. Modern breast reconstruction can help. The purpose of this presentation is to provide women with valuable information about the major issues in breast reconstruction.
We'll have an opportunity to speak with women who chose different methods of reconstruction. We'll talk to experts in the field of breast cancer, and we'll let you know your options for breast reconstruction.
I embraced the mastectomy and reconstruction procedure, and because of that, I had a terrific outcome, and it's changed my life in a positive way.
For the thousands of women who will be diagnosed with breast cancer this year, we understand this is most likely a troubling and frustrating time. We hope this presentation's been valuable to you and will help you make some very difficult decisions that you're facing.
Welcome back to the Doctor is in Television program. I'm Dr. David Morwood. I am a plastic surgeon, board certified here in beautiful Monterey, California. I'm delighted you could be with us for this next segment. I'm delighted to have as my guest, esthetician Alura Cortez. Alura, thanks very much for coming on the program.
Thank you. Thank you for having me.
I want our audience to know that I am so lucky that Alura works in my office, and she's terrific. And I want everybody to know what a good esthetician can do and how to become an esthetician, what happens when you come in for a skin analysis, etc. And we're going to talk a little bit, or a fair amount, about skincare. I want you to teach me. So, Alura, thanks very much for coming on the program.
Thank you.
So let's talk about your background. I think you have a very interesting background. Weren't you in the military?
I was in the military. I actually started out as a dental assistant in the Army.
So where'd you get your training to be a dental assistant?
I was actually in San Antonio, Texas.
San Antonio, Texas.
Mm-hmm.
So you got your training to be a dental assistant in the Army, and then for how long were you in the Army?
I did 6 years in the Army.
6 years. Did you do any tours overseas, or did you stay in North America?
I did one tour overseas.
Where'd you go?
I went to Iraq.
Wow.
Yeah.
And you worked?
Well, I worked. I ran a dental clinic over there. Yeah, I served our soldiers and, the people that work there.
Wow, Alura, that's awesome. Great service for our country. So you were a dental assistant, and you were in the Army for 6 years. So what sparked your interest in becoming an esthetician?
I think it really was more so I was always into beauty and skincare and, being a girl, I always loved makeup and things like that. But it was really when I started having clients that had skin issues that I wasn't able to help them with because I wasn't really knowledgeable in taking care of skin. I knew how to apply makeup to it, but not to take care of it. And so that's what got me interested in going and becoming an esthetician.
Excellent. So speaking of coming to see an esthetician, you're really good and experienced, I think, about starting a skincare program and designing a skincare program for someone, right?
Definitely.
Now, I think you're familiar with this concept that I have, the triangle of beauty, right? We have the skin, which is the texture,
right.
the three corners of the triangle. We have the skin texture, we have the volume of the face, and then we have the soft tissue amount and position. And on top of the foundation, of course. And it's my strong feeling that we need to address those individually. Like, we can't sell everyone a laser facelift, or we can't lead someone to believe that if they get regular facials, they may not need an eyelid tuck. Although it can help to keep your skin in good condition, I think is great. So, Alura, why don't we start off by teaching the public and teaching me about the basic steps, I think there are 6, the basic steps to good, effective, high-quality skincare. What do you want your clients to know?
Well, definitely starting first with a regimen at home. It's really important to have good skincare products at home. You don't want to just use bar soap or anything over the counter, especially if you're getting medical treatments like laser and things like that. You want to have professional products, either from a medical or an esthetician, and that way they can design what is best for your skin type and your actual concerns and needs for your skin.
So, Alura, I have a question for you, and I'm sorry if I'm interrupting you a lot, but I really want to learn about this stuff. So you said perhaps bar soap is not the best thing to use on your face.
Right.
In fact, are medical skincare products better for you than maybe bar soap or things you might be able to buy over the counter?
Definitely, and it also depends too on what it is that you're trying to achieve with your skin. So if you are having skin issues or concerns, the last thing is, you don't want to use just a bar soap. You want to use something that's actually going to help correct those issues. So a professional product is the best way to go.
Okay, so in my office, two of the most important principles that we try to convey to people are, of course, are avoiding direct sun. I think it's really important to teach
Right.
people that even though sun feels great,
Of course.
the UV rays really disrupt the collagen bonds and diminish the elastin and can lead to hyperpigmentation, etc.
Right.
So what we want to teach people is to minimize their sun exposure
Right.
and to avoid smoking. Isn't that
Yes,
correct?
Definitely. I mean, those two are very important. I always tell my clients sun protection is the number one thing I always say when it comes to a skincare regimen. You want to have sun protection among the other things that go with skincare.
Okay, so let's go through, and I think that there are four main components. After teaching someone to avoid direct sun and no smoking,
Right.
I think we want to teach people to properly cleanse their skin that
Right.
we've touched on, and moisturize their skin, and to how to properly exfoliate, and then the all-important stimulating the skin and regenerating the certain layers of the skin.
Right.
So why don't we start with cleansing? How do we learn to properly cleanse our skin?
Well, with properly cleansing your skin, it depends as well as the product that you're using. Some products require you to wet your face first. Some products require you not to wet your face first. So depending on the product that you're using, you want to follow those rules and apply it to the skin, in a good sense, a good amount. I would say nickel size is about right. And apply it to the skin and just apply all over and rinse off. And then you would use your, depending if you're exfoliating, I would say exfoliating is good to do at least once a week. If you have acneic skin or oily skin, 2-3 times a week is good for exfoliation for that skin type. And then you want to use a moisturizer and then your sun protection.
Okay, so we talked about sun protection, we talked about no smoking. We
No
talked
smoking.
about properly cleansing your skin.
Yeah.
What about moisturizing your skin? Isn't it true that some people, of course, have oily patches or oily skin, and some people have dry skin?
Right.
Now, I think you do a facial analysis, skin analysis for people, and you help design a program. Isn't that correct?
That is correct. That's inquired with our facial. We do a skin analysis first. We talk about what they think they have wrong with their skin or their skin type. And a lot of times people, don't use a moisturizer because they don't want oily skin. But in fact, you do need a moisturizer even if you do feel like you have oily skin, because your skin still needs moisture whether you're oily or not. And what happens is when you're oily, it means that your body is lacking water, it's lacking moisture. So it's producing extra oil because now it's thinking, well, it's dry, let's make oil. And so that's what happens. And so a lot of people end up even more oily than if they hadn't used a moisturizer in the first place.
Okay, so properly cleansing your skin is important. Properly moisturizing your skin is really vital.
Yes.
Now, there are two other components. Exfoliation, which I think we can define that as getting that very top layer the very top layer of the skin, the keratin layer, it's like nails and hair.
Right.
It's not living itself.
Right.
And so we don't want that to become too thick.
Right.
And the very top layer of the epidermis, we really want to shed off because
Right.
it can be unhealthy cells. Isn't that correct?
It's correct. And also, it won't allow your products at home to actually absorb into your skin and work deep within the skin like it should.
So how is it that we can get someone to exfoliate?
Well, with their skincare regimen at home, that would be something that would be in their regimen, doing it once a week. It could be either another cream or another mask, or even a mechanical way of doing exfoliation, which is using a brush, or, you know, now they have different tools that you can get, you know, at Sephora or wherever. But things like that, that will help exfoliate the skin as well.
Okay, so by exfoliation, we mean we're encouraging that very top layer to not get too thick, to come off, because we want the skin to have a glow.
Right.
And a sheen to it, right?
Definitely.
Now, we know that that keratin layer is kind of a barrier to keep in some moisture. So I think it's important that we convey to people, if they're exfoliating, it's still important to moisturize their skin.
Yes, and that's also something that I explain to people when they come in and we discuss their skin type and their regimens, and discussing how they use their exfoliation. Like I said, not everybody wants to exfoliate 2-3 times a week, depending on your skin type. So, you know, with that, you modify it to the skin type.
Okay, now that sixth component is regeneration. We really want to encourage the germinal matrix, that's where the baby cells are made, to churn and turn on that factory.
Right.
And I think one thing we want to teach our clients and our patients is that it takes at least 30 days for the new baby cell to get from the germinal matrix all the way to the top where it's maybe even visible, right? So what I noticed was sometimes people will come in and they may tell you, or they tell me, doctor, you know, I tried skincare for 2 weeks and I don't see that much difference. Well, they haven't even given their body one cycle, one chance to get that baby cell to the top of the skin. Isn't that correct?
That is correct. And I always inform people as well, when you're using a skincare product, you want to allow your skin 30 days to use that skincare product, because that, like you said, it allows the cells to really turn over. And giving it that much time, it needs that much time. So 2 weeks isn't enough time for you to see any kind of results with skincare, whether it's professional or non-professional products. You still want 30 days to be using the products.
Excellent. And what we try to convey to people is taking care of your skin is a lot like taking care of your teeth, right?
Oh, definitely. And you know that because I was a dental assistant, so I agree with that totally.
That's right. Not only do you have great skin, you have great teeth.
Thank you.
So we want them to get into a regimen on their own at home, just like taking care of your skin.
Yes.
And then they come in on occasion to have a facial or get evaluated. It's like seeing the dental hygienist or seeing the dentist, correct?
Correct.
So let's recap, and then I have some more questions for you, okay?
Okay.
So in general, if we can summarize the 6 major components to good skin care: number 1, avoiding the sun, direct sun. Number 2, no smoking.
No smoking.
Then there's properly cleanse, properly moisturize, exfoliate. That's when we encourage that very top layer to kind of shed, and we want to encourage regeneration.
Right.
Right? Okay. So now a person can do that, get started doing that at home with a home skincare regimen, correct?
This is correct, yes.
Now, just like coming in to see the dental hygienist or dentist,
Yes.
what happens when someone comes into the office to see you? Do they get a facial? Do they get analyzed? You check up on them? You do mini peels? You do micro peels? You do microdermabrasion? I mean, what is it that an esthetician does?
Well, we do all those things, all the above, but it depends on the patient that's coming in and what they're really concerned about, and that's where we discuss their skin type. We do the skin analysis. I also would encourage to do the facial first before doing any kind of treatments or any abrasive treatments right away, because I would want to have her on a skincare regimen at home for at least 30 days before doing any kind of laser treatments or skin peels or things like that. So I would definitely encourage those things to happen.
Okay, so you talked about laser, and we mentioned, I've mentioned a TCA peel. Those are ways, once the skin is primed up.
Right,
Right?
correct.
Now once the skin has exfoliated, at least for a basic degree, and we've turned on that factory to make new baby cells,
Right.
then we can introduce somebody to micropeels or a TCA peel,
Right.
or even laser, correct?
Yes, correct.
And that's a way to kind of dramatically kickstart or dramatically affect the health of the skin. Isn't that right?
That is correct. And you know, I always tell people they have the option to try something abrasive right away, but then there's the factors of not having the proper skincare. So, you know, a lot of people really want the quick fix, and I always suggest not doing the quick fix and, you know, really having a skincare regimen first, prepping the skin, and then going towards more abrasive treatment if that's what they're truly wanting.
Okay. Alura, that reminds me, you know, sometimes we have people come in, we have a patient come in for the first time, and they want to just sign up for laser, or they just want to sign up, schedule a TCA peel. They've not really taken good care of their skin. What I do, I equate that. I tell people that if you want to do a marathon, you need to train for it.
Definitely.
Right? You need to start slowly. You need to get in shape.
Right.
You have to get your legs ready. And you've got to watch what your weight is, and you've got to watch what you eat, and get ready to do the marathon.
Of course.
Because you could maybe go out and run a marathon, but you might hurt yourself.
Oh,
right?
definitely.
So
Definitely.
I think the people who get the most out of a TCA peel or laser really get their skin primed up. Isn't that right?
That is correct. You're absolutely right. I mean, that's always what is encouraged first, especially me being an esthetician. I don't ever really want to encourage people to do something really abrasive right away, especially knowing that maybe they hadn't taken care of their skin prior. So, you know, that's why I always suggest skincare regimen at home is really important. Even coming to see me once a week, if you're not using proper skincare at home, you're not going to see the best results. So, you know, prepping the skin, getting it ready, and actually using things that are meant for your skin type is going to be beneficial for you. And then that way you'll see better results.
Excellent. Now, Alura, we have about a minute left. Okay. I want to ask you about a couple specific scenarios.
Okay.
You mentioned acne-prone skin, and so I want to get some insight into that.
Okay.
How is it that we can approach someone who has acne-prone skin? And then there's another issue of people who seem to have lots of blocked pores and have blackheads and kind of that problems with thicker secretions and sebum and stuff like that. So how is it that you approach a person who comes in and they feel like they're acne prone?
It depends on where they're having the acne. A lot of people, I would say a lot of women right now are experiencing hormonal acne, which is kind of confusing because they think that it's like an acne when they were like a teenager, but it's really more hormonal. And so finding that a lot of women are experiencing that acneic skin is always a good suggestion to make sure that they have good skincare, proper cleansing at home, and also maybe taking some kind of supplements to help with hormonal imbalance, because taking care of the skin on the outside is great, but when you have things going on in the inside of the body, that tends to show through the skin. And depending on where it's placed, it really tells me as an esthetician what's going on with the skin.
Excellent. One of the things I will often want someone to learn is to think of acne as an inflammatory process. It's because the skin is irritated and inflamed and not necessarily infected.
Right.
Although, if a person has inflammatory acne, it can lead to sort of superficial infections. It's primarily an inflammatory process.
Yes, definitely.
Now, Alura, and again, we need to wrap up shortly, but what about the person with lots of obstructed pores, like blackheads or comedone, things like that?
Usually those people aren't using proper cleansing or the proper cleanser for their skin. And usually if they have a lot of secretion and things like built up, I would suggest maybe doing an exfoliation a couple more times a week, you know, incorporating that with their skin regimen. Because a lot of times using something as an exfoliator helps remove dead skin, but you want something that has some enzymes in it, and that way it eats away at the dead skin and kind of really helps clean out the pores a lot better than just removing dead skin. So it gets it deep down into the pores and works a lot better. So something like that is what I would suggest for people who have that kind of concern.
Excellent. Alura Cortez, you're an esthetician. Thanks
Yes.
very much for talking with us today. I hope you come back on the program. I'm learning a lot, and I think that our viewers in the public will learn a lot as well.
Thank you. Thank you
Alura
for having
Cortez.
me.
And I'd like to give out the number. Okay,
Okay.
Alura Cortez, 831-646-8661. She is in the office.
I'm in the
of
office.
Dr. David Morwood, a board-certified plastic surgeon here in beautiful Monterey, California. This is the Doctor is in Television program. We're coming right back after a very brief pause for a very good cause. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. Here in California, we all love the outdoors. Golf, tennis, going to the beach. However, the sun can play havoc with the delicate skin on the back of the hands and neck. Call or click today to learn the newest methods for restoration and beautification of the hands, neck, and other areas affected by the sun. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. One of the common goals I share with my patients is that they look natural after their facial rejuvenation.
Dr. Morwood made me feel really comfortable. His staff is phenomenal. Going into his office is always a great experience.
Call or click today to learn how our combined approach of art and science can enhance your natural beauty. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. A smooth, firm neckline is a universal sign of beauty in both women and men.
Dr. Morwood not only helped me regain my confidence, he helped me achieve the best version of me.
Call or click today to learn how the natural neck lift can rejuvenate your beautiful neck and jawline. Welcome back to the Doctor is in Television program. I am Dr. David Morwood. I am a board-certified plastic surgeon here in beautiful Monterey, California. Thank you very much for being with us today. What I'd like to do in this next segment is to take a deeper look at the natural neck lift and look at some adjunctive procedures. Many of you are familiar with the natural neck lift by now. We've done segments on the natural neck lift, and I've given seminars on the neck lift. To review, the natural neck lift is a system of careful analysis evaluating your appearance, your anatomy, your goals, leading to a custom designed approach just for you. I think it's really important to emphasize that everyone has a different face, everyone has a different neck. You present with different goals, you present with different sun exposure, years, etc., or weather patterns that you've been exposed to. So everybody gets a custom designed approach in our office and in my practice. So just to recap, what we need to do in high quality plastic surgery, as in any type of surgery, is have a precise, thorough knowledge of the anatomy. We need to look at the skin, we look at the surface of the skin, and of course, for all intention purposes, what we talk about is the epidermis being on top of the dermis. And then there's the subcutaneous layer, that's the fatty layer. On top of the muscles, there's something called fascia. That's a connective tissue that has some strength. It can be very thin and wispy, like a piece of paper, or it can be very thick and heavy, almost like leather. That's fascia. And then there's the muscular layer. It's very important in the neck. And in the neck, there's something called the subplatysmal fatty layer. That's the location of the fat underneath the platysma muscle. And then there are some other structures that we can talk about. There are the submandibular glands, which are the two lumps which make saliva. It makes spit for underneath the tongue. And these are the two lumps that you'll feel on the two sides of your trachea or larynx or pharynx. here at the cervical mental angle, oftentimes called the angle of the neck. Those are the two soft, about the size of a small ping pong ball. Those are the submandibular glands, which can be enlarged in some people and covered with that subplatysmal fat, surrounded by the subplatysmal fat. And there are also two muscles besides the platysma that we can talk about, and those are the digastric muscles. In some people who have a rather stout neck or lack an angled or cervical mental angle, lack a well-defined neck, the digastric muscles can be involved, and the hyoid bone can be involved. The hyoid bone is like a horseshoe-shaped bone that's almost free-floating within the neck at that all-important cervical mental angle. The cervical mental angle is the kind of bend or the contour in the neck that we all, men and women, like to have. So again, to recap, the natural neck lift is a system of evaluation looking at your anatomy, your appearance, your goals, leading to a custom-designed approach. So the natural neck lift, we have to start by looking at the skin. Oftentimes, people can be helped by exfoliation and moisturizing the skin of the face and neck properly. We must be very careful, however, when we talk about treatments like TCA peels, lasers, etc., when we talk about the skin of the neck. The skin of the neck is different than the skin of the face. There's a relative paucity or shortage of the appendages of the skin, the pilosebaceous appendages. What that means is that the skin of the neck has fewer oil glands, sebaceous glands, in general fewer sweat glands, fewer hair follicles than the skin of the face, and therefore we need to be very careful when we treat the skin of the neck with rapidly exfoliating procedures like TCA peels and laser. We need to do that very judiciously. For example, if I do a TCA peel of the face, it may vary from 30% in the perioral area, the thick skin of the lips and nose and forehead, where I will oftentimes really scrub those lines, the lip lines, to really get a good effect. I would very rarely, if ever, do that type of strong TCA peel for the neck. Much more like 10%, 15%, maybe 20% TCA peel to the neck. 20% for perhaps the most sun-damaged skin of the neck. But the skin of the neck is much thinner, has fewer appendages, fewer pilosebaceous glands, and so we need to be very prudent when we talk about treating the skin of the neck. We need to look at the next layer, which is the fatty layer. We can do liposculpture, microliposculpture, and liposuction of that fatty layer. That's also the layer that is treated with some injections now. There's a Kybella treatment where we inject something that helps dissolve the fat, deoxycholic acid. Next, we need to look at the platysma muscle. The platysma muscle runs from the mandible, the jaw, down to the clavicles. In our species, it's vestigial. It's like the appendix. It has no other use but to give plastic surgeons work. And so when that muscle becomes loose and tends to pull away from that deeper cervical mental angle or hang, it presents with cords. Now, to a certain degree, we can get some effect with Botox by getting that muscle to relax. And as it relaxes, it can fall back. When it's dramatic, a person will need a platysmoplasty. When a person comes in and says, you know, I want this turkey neck treated, or I want a wattlectomy, we need to look at the skin, of course, but we also need to look at that platysma muscle. Now, when we talk about deeper structures, we will oftentimes need to address things like the subplatysmal fat. On rare occasion, I would address the submandibular glands, those very prominent glands that are on each side of the pharynx. I would say even more rare, in more rare instances, I will address the digastric muscles and the hyoid bone. I think those are relatively invasive procedures going a layer deeper. And most of the time, I'd say the far majority of the time, I can accomplish and a patient can have a crisp, clean, well-defined chin, neck, and jawline without going to those deeper structures, to the submandibular glands and the hyoid bone and the digastric muscles. On occasion, I will be very conservative and sculpt the sublatissimal fat. I'm willing to do that, but I'm very conservative with going after the submandibular glands. When someone has very prominent submandibular glands and they're bothered by them, I think sometimes going after the superficial lobe can be effective, but I don't like to take out the entire gland. We don't like to risk giving someone a dry mouth. We don't like to overdo it. We don't like someone to have an overdone look. We want a, although full looking neck, we want it to be crisp and clean and firm and well defined in both men and women. Now, let's take a few minutes to talk about the chin. I think the chin can be very important in terms of having a graceful, elegant, beautiful, for men or women, handsome or masculine look, to have a clean, crisp, and smooth neckline, jawline, and chin line. We need to look at the position of the chin. There are some people who can be helped by making their chin more prominent. How do we do that? Well, one way we can conservatively advance the chin is with the use of fat grafting. Fat grafting is when we do conservative liposuction somewhere in the body, like the love handles, the abdomen, the flanks. We spin the fat down or decant it, and we can re-inject that. We can get a subtle advancement of the chin that way. I tend to overcorrect, as I said before in the last segment or the prior segment. Approximately 67% of the transposed volume will persist, so we overcorrect. So fat grafting can help bring the chin forward. Another way to do this in the office is with a filler, like a Radiesse, which is a calcium-based filler, or something like Voluma. That's a heavy, high G value hyaluronic acid that can be injected deep upon the bone for the cheekbones or the chin, and that way we can help to bring the chin forward. Going another step forward, there are chin implants. Those are firm silicone. Now, breast implants are soft silicone gel, but they're covered. The silicone shell is another type of silicone, but it's firm. A chin implant is firm, and that can be put in through the incision underneath the chin, or at certain times we can go through an incision inside the lower lip. We can make a pocket, wash it out very well, put in some antiseptic, and put the chin implant in that way. That can help bring the chin forward, or have the appearance of bringing the chin forward. That's probably more common with neck lifts and some facelifts, and sometimes we can do that and a person won't need a reduction rhinoplasty anymore, or sometimes we can do those together. One of my favorite ways to improve the chin, the jawline, and hence the neckline, is with an actual chin advancement called a bony genioplasty. That's where I can make an incision or a division in the bone itself. I can make the chin come forward. Now, it's not changing the dentition. We're not changing the way the teeth move, but we're just bringing the chin forward. It's called an advancement genioplasty. Sometimes I can even out a jaw or chin. Sometimes we can bring it lower. Sometimes of course, we always bring it out, so there's more projection. Sometimes I can actually bring it up a little bit. But most often, I bring the chin forward and slightly down, and I can secure it with wires or a plate and screw. Some of those are bioabsorbable, and we can fix the chin in a new position, thereby resulting in a much stronger chin line, jawline, and hence a neckline. Now, for the posterior angles or the mandibular angles, kind of the corners of the jaw, I think fat grafting can be helpful. I also like fillers in that area. We can do that right in the office of Voluma. There are some celebrities now that have quite prominent mandibular angles, and that tends to give a very well-defined chin, neck, and jawline. And of course, fillers can be done in the office. You don't need to go to the operating for them. We can do fat grafting in the office, etc. I don't do chin advancement bony genioplasties in the office. That requires an operating room. And I most oftentimes do that with a neck lift or even submental liposuction. Oftentimes on a younger person who has a very weak chin and a blunted cervical mental angle. That means that a blunted cervical mental angle or obtuse cervical mental angle really means that they're lacking that crisp, clean neckline or jawline where the chin and neck meet, that angle, that we call that the cervical mental angle. I'll oftentimes treat a person with that with micro-liposculpture. We can do that right in the office by suctioning or liposuction, lipoplasty. I do that by making a very small incision in the crease underneath the chin. Almost all Americans I meet have a scar there a scar there anyway, because their little brother pushed them on the stairs one time, or they fell from their bike or tripped on their curb, etc. It's one of the most common places presenting to the emergency room with a laceration underneath the chin. So I make a little incision there about the width of a pencil, and then I make one small incision where the earlobe meets the cheek on each side, and then I can pass a cannula, it's a suction tube, and I can honeycomb and mold and shape and tailor and remove that submental fat. If need be, I can bring the chin forward with a advancement bony genioplasty. When I do a platysmoplasty as part of the natural neck lift, I'm affecting the platysma muscle. Oftentimes I will do a submental platysmoplasty. That's where I make an incision in the crease a little bit longer, usually curved, almost like a soft U or a soft C, and I can go down, I can sculpt the fat in an open way, in other words, look at it, I can mold and shape and tailor, and then I can affect the muscles, I can tighten them up, I can reposition them, I can take care of those bands and cords. And very often with a natural neck lift, I will also come from the sides, around the ears or in back of the ears or the hair in the mastoid. I can make an incision there, I can tighten the skin, remove some skin, and I can reach down and reposition the platysma or tighten it up or make it more firm to result in a crisper, cleaner, smoothing neckline, jawline, and chin. Those are all parts of the natural neck lift, or components that we can offer to people. So once again, in summary, the natural neck lift is a system of analysis where we look at a person's anatomy, their appearance, their goals, leading to a custom-designed approach. We have many different tools in our armamentarium. It's a lot like the fishermen going out on the ocean or to the river, and the fishermen will bring a tackle box, and there's different lures and different sinkers and different baits. We need to use whatever works to help accomplish a person's goals. Many of these we can carry out in the office, or if someone wants to be sedated or take a nap, we can go to the surgery center or even the hospital. So we'll go through step by step in your analysis. We'll look at your photos, we'll look at the computer imager, we'll discuss your options, we look at the skin. Sometimes people need their skin tightened, shored up, repositioned, or removed. We look at the subcutaneous fatty layer. We look at the platysma muscle to see if they need a platysmoplasty. And then sometimes we'll examine and look at the deeper structures, such as the subplatysmal fat and structures deep to the platysma. If you want any more information about the natural neck lift or any other procedure in plastic surgery, I hope you'll visit my website, drmorwood.com, that's DRMORWOOD, or call the office here in beautiful Monterey, California, 831-646-8661. Once again, I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is the Doctor Is In television program. Thank you, Michael Martins. Thank you, Paul Congo, and thank you, viewers, for watching.